Hello, dear doctors, nurses, medical students, and healthcare team. How are you today? I hope you are well. Here we are going to explain another question about cardiology. A 44-year-old man who presently has acute renal failure has an ECG that shows tall tended T waves, flat P waves, and a wide QRS complex. What is the single most likely electrolyte abnormality? A. Hypophosphatemia. B. Hyperkalemia. C. Hypokalemia. D. Hypercalcemia. E. Hypocalcemia. And the answer is hyperkalemia because of the patient's history, which has renal failure, and hyperkalemia is very common in patients with renal failure. And also the specifications of ECG, which shows tall tended T waves, flat P waves, and widened QRS complexes. Here we are going to talk a little more about electrolyte imbalances and the effect of it on the patient's electrocardiogram. Okay, explanation. Acute renal failure is one of the causes of hyperkalemia. Together with the ECG findings points towards hyperkalemia as the answer. ECG characteristics in electrolyte disbalance. Hyperkalemia. Hyperkalemia with tall tended T waves, small P waves, widened QRS leading to sinusoidal pattern in a systole shows itself in ECG. As we can see in this ECG with hyperkalemia, we have tall tended T wave in some leads, even their T wave is longer than QRS complex. Okay, tall tended T waves and small P waves. We have here small P waves. Even in some leads, we cannot see a clear P wave and widened QRS complexes. And the QRS complex is widened, and this is the specification of hyperkalemia on ECG. Okay, hypokalemia. In opposite to hyperkalemia, the ECG patterns of hypokalemia, we have flat T waves. Here we have flat T waves and ST depression and prominent U waves. The ST depressed is depressed, and we have flat T waves, and we have prominent U wave. As we can see here, if this is T wave, here we can see U wave, and this is the specification of hypokalemia on ECG. U wave is important and is usually asked in exam questions, and we must concentrate in this point. Okay, hypercalcemia is shortened QT intervals. As we can see here in hypercalcemia, we have shortened QT intervals. We can see it on all of these ECG leads. We can see shortened QT interval, and in opposite, in a hypocalcemia, we have prolonged QT intervals. We have prolonged QT intervals in hypocalcemia. As we said, in opposite, in hypercalcemia, we have shortened QT intervals. And this was a short explanation of the effect of hyperkalemia, hypokalemia, hypercalcemia, and hypocalcemia on the patient ECG. Thank you for your attention.